Good afternoon. My name is Rhonda Dorsey. I am a BSN student at Nightingale College. My course number is 366-06. This is my neurovascular assessment skills video. So before I begin, approach my patient, I will go and I will verify doctor's orders, gather my equipment, and proceed to, into the patient's room. Knock on the door, enter and close the door behind me. Draw the curtain closed, providing for privacy. I'm going to set my items down on the bedside table. I'm going to perform hand hygiene. And at this time, I'm going to go ahead and I'm going to introduce myself, verify my patient by collecting the identifier's name and date of birth, and then I'm going to explain the procedure that was today's procedure. Okay, so again, hand hygiene performed. Hi, good afternoon. My name is Rhonda. I'm your nurse. Can you please verify your name and your date of birth?
Yeah, Gino Dorsey, April 7th, 1969.
Very well. So today the doctor has asked that I perform a neurovascular assessment on you. Okay? So with that being said, do you have any physical limitations?
No, ma'am.
Any physical pain at all?
No,
or
ma'am.
discomfort? Okay. So with that being said, basically this is a test checking your sensation, your mobility, your flexibility, your balance, and just assessing those the main items. Okay. Okay. So with that being said, I'm going to go ahead and I'm going to perform a sensory test assessment. Okay. So this is me touching various points of your body. You're going to feel dull and sharp. Okay. So with your eyes closed, I'm going to touch various parts of your body. You're going to let me know where I touched you and whether it was dull or sharp. Okay?
Dull right leg. Sharp right leg. Dull right leg. Sharp left leg. Dull left leg. Dull right arm. Sharp right arm. Sharp left arm. Dull left arm.
Okay, very well. Okay, you had me a little nervous at first because you mentioned sharp instead of dull the first time, but that's okay. You corrected that. Okay, so with that being said, let's go ahead and continue on with our sensory, your sensory perception. Okay, so with that being said, when I assessed the sharp and dull, it was very important for me to give at least a 2-second leeway, so that way he can identify the 2 points. Okay, whether it was sharp or dull. Okay, so with that being said, I'm going to touch areas of your body with your eyes closed, of course. Okay, and you're going to let me know where I touched you, and it's going to be with this soft cotton swab. Okay, all right.
Right leg. Left arm. Right hand. Left leg. Left hand. Right arm.
Very good. Open up your eyes. Okay, with that being said, I'm going to do what is called a 2-point test assessment. Okay, and so I have my paper clip here, and I'm going to touch your arm rhythmically. Okay, and you're going to let me know if you feel the 2 points.
Okay.
If it gets to a point where you no longer feel 2 points and it kind of feels like a 1 point, please verbalize that. Okay. And your eyes, of course, are going to be closed. Okay.
2 point. 2 point. 2 point. 1 point.
Okay, so with that being said, I would measure, go ahead and open your eyes, it's okay. So that at this point, I would go ahead and I would measure exactly the point where he referenced it was a 1 point, okay? And it would distinguish between the 1 and the 2 points, okay? All right, so with that being said, I'm going to go ahead and I'm going to check again your sensory, this is again your sensation, and so I'm going to either draw a letter or a number in the palm of your hand. Okay, and you're going to let me know exactly if it's a number or a letter. Okay. All right.
T, right hand. L, left hand.
Very good. Very good. Okay, so with that being said, I am going to have you turn your hands out. Okay, this test is going to be a little different. It's going to be, this is going to be you telling me again movement. Okay, sensory, it's a fine motor thing as well, right?
Yeah.
So I'm going to either lift your finger or your toe, and you're going to let me know whether I lifted it up or down.
Okay.
Okay?
Okay.
Okay, but again, your eyes are going to be closed.
Okay.
Okay? All right. And I'll just hold your hand up.
Up, down. Down. Up. Up. Down. Up. Down.
Very good. All right. And so now we're going to do is I'm going to check your, again, another motor skill. Okay, I have something, I'm going to place something in your hand that's very familiar. You're going to just tell me exactly what it is.
Okay.
Okay, so go ahead and open your hand. You can close your eyes for me. Okay, and tell me, what is the object?
It's a coin.
Okay, very well. And yes, it is a coin. Okay, so I'm not sure whether if I did the identification again. Why don't you go ahead and turn your hand over. All right, I don't know if I had you close your eyes, so we're going to try that one all over again as far as me drawing a letter or a number in your hand, okay?
Okay.
All right, so go ahead and close your eyes. All right.
L, right hand. O, left hand.
Very good. All right, go ahead and open up your eyes. I wasn't sure if we did that with your eyes closed. I just wanted to redo that. All righty. So with that being said, I'm going to have you check your mobility.
Okay.
Okay, this is you. What we're going to do, I want you to extend your arm out. And we're going to check your mobility, your reflexes by you touching your nose. Okay, left hand, right hand. You're going to have your eyes closed. Okay? And when I say speed up, you're going to speed up, but without injuring yourself. Okay?
Okay.
All right, go ahead and close your eyes. Okay, touch your finger to your nose. The opposite hand. Very good. Keep going. Can you do it a little faster? Very good. All right. Good job. Okay, so another one we're going to do, we're going to place your, this is checking your agility as far as your movement. Okay?
Okay.
Again, so have your hands placed on your lap. Okay, and then I want to have you have your palms up, and then you're going to rotate it, hands down, palms up, hands down, palms up. Keep doing it. Can you do a little bit faster? This is supposed to be rhythmic, but let me just check your speed and your dexterity. Very good. All right. Now what I'm going to do, I'm going to check again. This is your lower extremity. Of course, we're going to check again your proprioception. Okay?
Okay.
So I'm going to have you take your heel and run it down the side of your calf. Okay, nice, smooth, fluid movement. Okay, symmetrical, good. Excellent. Good job. Good job. All right. How are you doing?
Just sliding off the chip. I'm good.
Okay. So now what I'm going to do, I'm going to check your deep tenor reflexes. Okay? All right. I'm going to find. So I'm going to find your, got your appendage here, and I'm going to check your brachial and also your, and then also your patella.
Okay.
Okay? All right. Tibial. There we go. All right. Okay, I'm going to stretch my thumb. Okay? Oops, sorry. All right. Very good. So that was a 2+, okay, which is a very normal reflex. If it was a +0, that would be exactly indicate no flexibility whatsoever. And if it was more than a 2+, it would be hyper flexibility. And so right now, like I said, yours is normal.
Okay.
All right.
Yeah.
So let me go ahead and check the patella. Okay. All right. Very good. All right, good job. All right. So again, that's also a +2. Okay.
Okay.
So now what I'm going to do, I'm going to check your patellar reflex.
Okay.
Okay. Not your patellar, but your your plantar reflex.
Okay.
Okay. Okay. Let me just hold your foot. Okay. Can you go ahead and close your eyes? Good job. Okay. So, good reflexes. Okay. Abnormal reflexes would be if your toes spread out,
Right.
fanned out, and you didn't indicate that. You just had normal reflexes. Okay. So next thing I'm going to do is I'm going to check for colonics. All right. Let me put this right here. All right. So this is what I'm going to get down here. Make sure you guys can see me on the camera. Okay, let me just hold your foot. All right, I'm going to dorsiflex your foot. I'm going to hold it there for a minute and let go. Dorsiflex your foot. Let go. Okay, good reflexes. So basically what I was checking, the abnormal reflex to that would be if your muscles, if you had some contraction, rheumatic contraction spasms like, that right there would indicate colonitis.
Okay.
You did not indicate that. You had a normal reaction.
Nice.
Okay.
Nice.
All right. So now what I'm going to do, I'm going to have you stand up. We're going to check your balance. This is called a Lindbergh test. Okay. I'm going to have you close your eyes. Okay. Your hands down to the side of you. Good. I'm just going to make sure you don't fall forward or anything or backwards. Okay, very good. Go ahead and open up your eyes. All right, nice. Just a very slight sway, which is again normal. Okay. So now what I'm going to do is I'm going to check out your gait, your walk. You're not see how you ambulate. Okay. So if you can just move forward, walk forward, straight forward, and stop, and then turn around and walk back. Very nice. Very nice. So I saw fluid movement. Okay. No abnormalities in your walk. You had a nice sway. Your arms swung naturally. Your body was upright. Very, had a good posture, and I didn't see any stumbling.
Nice.
So to me, it was pretty normal.
Okay.
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 You have any questions or concerns?
No, ma'am.
All right. Let's go ahead and have you sit down. Okay. Okay. So, with that being said, our assessment is complete. And so what I would end up doing is that I would provide hand hygiene. And then I will go out and I will document my findings, subjective and objective findings. And that concludes my assessment. Thank you. Have a good evening.